Hi, my name is Dr. Vivek Belathur. I'm Senior Consultant Medical Oncologist. Today I'm going to talk about one of the important aspects of breast cancer treatment. So, that is about hormone receptor status in breast cancer. So, whenever someone is diagnosed with breast cancer, one of the most important aspect of that diagnosis is hormone receptor status, also what is known as ER, PR, and HER2 status. So it's very important to know the hormone receptor status of a breast cancer patient because that determines the prognosis of the patient as well as the treatment. So I'll show you a real example of how a receptor status report looks like. As you can see here, so this is one of my patients' receptor status of breast cancer. So you can see that the estrogen receptor or ER is positive in these patients. So it is 5 plus 3, that is the score is 8 by 8. Similarly, the PR or the progesterone receptor status is positive in this patient and the score is 4 plus 3, that is 7 by 8. So the score can vary between 0 to 8 for both ER and PR. And the third important aspect of the receptor status is called HER2 new. So the receptor status result can vary between 1 to 3 plus. So in this patient, it was 2 plus. So it can be 1 plus or 2 plus or 3 plus. If it is 1 plus, we take it as negative. If it is 3 plus, we take it as positive. Whereas if it is 2 plus, then it is called equivalent or equivocal result, and that needs to be reconfirmed with one more test called a FISH test. So fluorescence in situ hybridization test or ISH test will help us either confirm this or rule it out. So with that we will have four different permutation and combination of these three receptors. So as you can see here, so ER, PR, HER2, they can be either completely positive or they can be completely negative, or other two options are that ER, PR can be positive and HER2 can be negative, or ER and PR can be negative and HER2 can be positive. So what is the implication of these ER, PR and HER2 positive or negative status in any given breast cancer? So when somebody's HER2 is positive, then when we add one injection called Herceptin or trastuzumab, or there is one more injection called pertuzumab to their chemotherapy backbone. So we add anti-HER2 therapy, which is targeted therapy, to the chemotherapy. Whereas ERPR, if they are positive, we give hormonal therapy at the end of the treatment of breast cancer. Like for example, if the patient receives chemotherapy first, and then they would undergo surgery and then radiation, and at the end of all these three treatments, then we give them hormonal therapy at the end of the treatment. So similarly, as you can see here, if somebody is only HER2 positive and not ERPR, then they would go on to receive only anti-HER2 therapy, that is trastuzumab plus or minus pertuzumab during the chemotherapy, and after the chemotherapy, they wouldn't receive hormonal therapy. So this is the importance of ERPR and HER2. And similarly, as you can see here in this patient who is ERPR positive and HER2 negative, this patient doesn't require anti-HER2 therapy or Herceptin or trastuzumab or pertuzumab. They would only go on to receive chemotherapy and hormonal therapy at the end of treatment, as I mentioned earlier. So this is very important. So if somebody is ERPR positive, then they are expected to do well in the long run. Whereas those patients who are HER2 positive also would do well at the end of the treatment. One of the subsets of breast cancer patients, or one group of breast cancer patients who may not do that well if they are really advanced disease, is the triple positive or all three becoming positive, as you can see here: ER positive, PR positive and HER2 positive. However, with newer treatment options, we are able to overcome that difficult situation. So this is about ER, PR and HER2 status in stage 1 to stage 3 cancer patients. Whereas in stage 4, if ER, PR is positive and HER2 is negative, we would give only hormonal therapy to stage 4 patients in this situation and no chemotherapy. I'm talking about stage 4 cancer. Similarly, if somebody is HER2 positive in stage 4, we would consider some chemotherapy along with trastuzumab and pertuzumab, and no hormonal therapy. So, breast cancer treatment, becomes a bit more complicated based on these three receptor status. So this is about hormone receptor status in breast cancer. If you have any other questions, you can contact us. Thank you very much.